Good afternoon. I welcome you to Westpark's annual Donor Appreciation event. I'm Doug Earle, CEO of Westpark Foundation. Thank you for joining us today. We're delighted to have this opportunity to say thank you face to face, well, at least virtually, for your commitment to Westpark and your generous support of our patients. And we're excited to introduce you to Dr. Jamal Daperdine, Westpark's new geriatric specialist and lead of our new geriatric strategy. Dr. Daperdine is transforming rehabilitative care for seniors at Westpark, and his team's work will have an impact on our broader health system. Today, he is going to speak to us about how our new building will help expand our rehab programs for seniors, and a new health system improvement project called Rapid Rehab Access that we are demonstrating it will be a game changer for seniors and families. These innovative programs are among the many ways that Westpark is helping improve care for Ontarians and to shape the future of our health system thanks to you. We are able to grow and innovate in this way because of the increased capacity and capability of our new building. And your generous support has helped make it possible. Today, you can ask your questions of any of our speakers by typing into the Q&A feature on the Zoom menu. After our speakers present, we will open those questions to be answered. We are going to get an update today from about our new hospital from Shelley Diddy, Vice President, Campus Development and Support Services. It is a milestone year for Westpark as we take possession of our new building in July and open it to patients in November. And then we will turn our focus to the outdoor therapy spaces and their construction. But first, I'd like to invite Anne-Marie Malik, President and CEO of Westpark Healthcare Centre, to say a few words. Anne-Marie?
Thank you, Doug. And thank you to everyone for joining us today and for generously supporting Westpark to make a difference in the lives of our patients. Thanks to you, people facing serious injury and illness are supported on their very difficult journey to regain their health, their independence, and to get their lives back. Your support has helped us during this time of transformation. The beautiful new hospital building we're opening later this year stands as a testament to your commitment to our patients and to the care we provide. More than a decade ago, as we were planning for our redevelopment, one of the drivers of our vision for the campus of care was the demographic changes we knew were coming. We knew we had to plan for an aging population and their healthcare needs. Additionally, the COVID-19 pandemic taught us many things. One of the most critical being that the health system needs to respond better in providing care to the aging population. That's important because people over 65 years old represent more than 17% of the GTA population. And we expect this number to double in the next 10 years. Further, while the seniors population over 65 represents 17% of the population, they consume about 58% of hospital days. So it's clear we need to change the delivery of healthcare to accommodate our growing seniors population and enable them to live at home independently for longer. We need to ensure that people can get the care they need when they need it in a facility best suited to providing it. When our new hospital building opens in November, it will have an immediate impact on our healthcare system. With it, we will improve access to our post-acute care services, so crucial to people as they age, and will transform how we deliver these services to better meet the needs of our patients. The new hospital will allow us to grow and innovate and add new, much-needed programs such as the geriatric services that Dr. Daperdine is now leading. I'm very much looking forward to his talk. But first, I'm delighted to ask Shelley Diddy to provide an update on our new hospital. Over to you, Shelley.
Thanks, Anne-Marie. Very pleased to be here and update again where we're at with the new hospital. You know, we used to say when we did these sessions and we're reaching out to our donors, you know, we're a few years away before the hospital would be complete. Well, now we're actually a few weeks away from the completion of the hospital. So it's a very, very exciting time for West Park. So we are actually targeted to achieve substantial completion by July 31st. And what that means is Ellis Don, who are our contractors, they'll hand over partial parts of the building for our use. And this basically allows us to get ready for our patients in November. So right now, our current activity on the site is really finishing up some of the construction, completing certain areas, do the finishing. So whether that's painting or putting in millwork, we have a number of pieces of equipment now arriving on site. We're doing some testings of our IT systems and also commissioning the building so that it's ready for us to actually occupy it. So in preparation for, you know, the actual move, we have a significant amount of training and orientation planning that is underway. And so it's really important for us to prepare our staff, you know, to be familiar with the new processes, the new equipment, our technology that we've incorporated into the building. And again, to be ready for our patients to move in. So the move planning is also underway, and that will happen at the latter part of November. So again, there's a lot of work that needs to be planned and developed because we want to make sure that the move is as smooth as possible and we can provide the best care possible at that time. And finally, and I think Doug mentioned this as well, once we occupy the new hospital, the plan is to demolish the existing buildings and then create our incredible therapeutic gardens. We have walking trails, we have specialized terraces and courtyards, and all with the intent of enhancing the rehab potential that we can provide for all our patients at the hospital. So I think with that, that's just a brief overview of where we stand with the development of the hospital, and I'll turn it over to Doug.
Thanks, Shelley. And congratulations to you and your team. And I have to say, a job very well undone, or done, almost done. And I have to underline very, because it's such an amazing building right now, and I can only see the potential of it as we are getting ready to move in. So now it is my pleasure to introduce Dr. Jamal Daperdine. Dr. Daperdine joined West Park in March 2022 as our geriatric specialist. He is a specialist in internal and geriatric medicine, with a subspecialty interest in geriatric cognitive disorders. His vision is at the center of what West Park is working on as a critical hub for collaborative networks of care with other hospital partners. It's really exciting, forward-thinking work. So let's hear a little bit more. So welcome.
Hello, Doug.
Great, thank you. So let's start our conversation with what made you passionate about caring for seniors?
So when I was an internal medicine resident, I completed that before doing my geriatric subspecialty. What attracted me to geriatrics in particular was that it was the quintessential bringing together of the biopsychosocial model, that you're helping individuals to meet their medical goals, whether that's heart failure or diabetes, but also you're looking at the patient-family interaction, you're looking at quality of life and satisfaction, and you're really delivering essential care to a population that actually appreciates and needs that care. And there's the opportunity to not only transform the lives of individuals, but also to transform the lives of communities as our populations around the country ages. So I was passionate, I was intrigued, and I am actually so happy that I chose this career path.
Fantastic, especially as our population is doubling, it's going to become even more critical. What attracted you to West Park?
So West Park is really at a critical nexus right now. We're situated in a community, as Anne-Marie mentioned, that is aging. But when I was speaking with the team at West Park, the leadership, the other members of the Allied Health, there was a honest and a very compassionate dedication to developing the geriatric program here. There was the new hospital build that's going to be a focus for the community as well. And there was also a earnest commitment to collaboration and to working in solidarity with partners in the community and in acute care, which is part of my philosophy of care as well. I feel that as health professionals, whatever our designations, we are not islands and we cannot operate as islands. We have to work within a frame of collaboration and a frame of bilateral communication. And West Park really embodies that on an honest basis. And I was very excited by the opportunity to be part of building something that will be a lasting legacy, not only for our patients, but also for our patients' children and families moving forward into the future.
That's amazing. I must say, when I talk to patients and their families, that it's the staff at West Park that you met when you were making your decision that really makes the difference for the care they receive and such helping them get their lives back. So how is West Park senior care changing to get ready for this new reality?
Well, there are really two aspects to that in terms of how we're preparing and what we're doing on a practical basis to implement change. So the first aspect is from the inpatient, so people who are admitted to the hospital. So if as you have alluded to, over the last several months, since early 2023, actually late 2022, we've been working with the group at the St. Joseph's Health Center, their emergency department leadership and the geriatric team there and their director to develop a collaborative inpatient program that we've branded as the Geriatric Rapid Access Rehab. And effectively, what we've done there is we have developed a pathway and a process collaboratively with St. Joseph's, where older patients who are in the emergency department at St. Joseph's Health Center and who aren't really ready to go home, they either have mobility concerns or there's some concerns around medications or some of their other medical issues, but they don't really need to stay in an acute care center like St. Joe's. We're flagging them early and we're prioritizing them for expedited transfer to our inpatient rehab setting for a 2 to 3 week stay, where we're working with myself and the rest of my amazing team on not only their physical well-being, but also reviewing their medications, looking at their memory and their mood, looking at social planning, all of the critical aspects of geriatric medicine on a dedicated unit with dedicated professionals. So number one, looking at working with St. Joe's in terms of avoiding unnecessary admissions to acute care to allow them to best utilize their resources, but also facilitating faster transfers to subacute care or rehab care here, and also making more successful transitions for these patients back home. We've been doing this since around February, March of this year, and that partnership has really worked well. We've had interest from William Osler and now Mackenzie Health to also implement that same pathway and program. So we have the inpatient where we're developing new programs and working collaborative with our partners. We also have a geriatric day hospital, which will be opening in our new building. It'll be the only one in the Northwest Toronto region. So we'll have seniors who are living at home, coming here, working with our team, both again, physically, but also looking at their medications, looking at their social supports, looking at things like swallowing and diet, and endeavoring to keep people who are doing well at home, continuing to be doing well and independent and mobile at home for as long as possible. Our clinics are expanding. We're adding more days for our geriatric clinic because of increasing demand as well. And we've also been working very closely with our seniors mental health group, seeing our older patients in the community. So we have multiple facets of work that not only we are planning, but we are actively implementing. And we're doing this in a collaborative frame, and we're doing this in a frame of how can this be sustainable over time? And that sustainability requires, ongoing work, both with our internal partners, people like yourself, my team, the Allied Health, but also our external partners as well.
Mm-hmm. Just going back to the Rapid Rehab Access Program, what is the outcomes that you're hoping? If someone shows up at Emerge, they're not needed really to stay there. They come to West Park, they go through our program. What do you hope? What 6 months, 12 months from now, what are some of the outcomes that you're hoping for?
So we know based on the research and the data that we have, things that I've reviewed, things that our team's reviewed as well, that there are very specific positive outcomes that are associated with being on a dedicated geriatric inpatient unit. There are principles of geriatric care, and values of a geriatric assessment with a multidisciplinary team as well. So if we're looking at 4 to 6 months, we're looking at, are people remaining in their homes? Are they still independent for things like dressing, for bathing, for their cooking, those types of functional tasks? We're looking at hopefully mitigating the risk of falls as well. We do know that exercise is the #1 most consistently manifested variable that is efficacious for reducing the risk of falls in the elderly. And we're also, considering, are we able to mitigate recurrent presentations to the emergency department by having people here and working on some of the issues that maybe might fall through the cracks if they were sent directly home, or maybe their other care providers don't have as much time or as much expertise to focus on, like very subtle changes in memory or in mood. And we also find that it's very, very important, 2 other aspects. Number 1, looking at patient and family satisfaction. So are we able to demonstrate as well that 4 or 6 months down the line, having this assessment and being on this unit improves the satisfaction, improves psychosocial outcomes for patients and families. And the last is, again, around us as a nexus and us as a hub for developing relationships and partnerships with our community-based health providers and also our providers in acute care. So are we actually developing new and successful relationships, which I can say, even at this point, about 3 months in, we are. So that aspect of really demonstrating impact and continuing to consider both the process, but also the patient and family, and also the networks is all critical to us. And I'm excited because I think we're doing great work here.
It's amazing. Of course, that sounds like a 360-degree view of someone who's trying to recover and get better. So can you talk a little bit about how this program, what implications it may have for the health system in Ontario?
Definitely. So Doug and Anne-Marie, you've touched on some of the shifting demographics for us, not only in Ontario, but in Canada in general. We do know that the population is aging, not just in terms of absolute numbers, but in terms of relative numbers as well. And that trend will likely continue for at least the next 10 to 15 years, before we see a plateau with respect to the proportion of seniors in our communities. We do know that as people age, they do tend to accumulate more medical issues, and they tend to be higher users of medical services and spend more time in hospital. And with our system now, there's been a lot of talk around how do we make the system as efficient as possible, deliver the best care in the most timely way, in the most appropriate setting. And the majority of patients that I see, the majority of people that I talk to, and my team in the clinic and on the ward sees say, well, doc, I want to maintain my independence. I want to be able to bathe myself, dress myself, walk. I want to be at home, and I want to be integrated into my community. I want to be able, if I want you to volunteer, I want to be able, if I want you to go and take an art class. And I think that aspect of independence and community integration is very critical, and it's very important to us as healthcare providers. So at a high level, what are our goals here with the rapid rehab on the one inpatient basis, but with the geriatric day hospital and with our clinic on the outpatient basis, looking at this, as you said, as a 360, cohesive view, is are we able to take this and allow people, number 1, who have experienced an admission to St. Mike's, St. Joe's, an acute center, to be able to transition more successfully back home, to have the evaluation of their entire biopsychosocial picture, to have the resources to not only get home, but to get home with the right support, to stay home, to be independent, and to be socially integrated. And for people who are still at home, which is the majority, most of our seniors are not in a hospital now, can we keep them in their communities, mobile and independent for as long as that is possible? And that involves proactive care. So what we're looking at are people who have experienced mild changes. There's some little bit of slowing in their walking. There are a little bit of changes in their memory. They are on a couple of medications and there's a bit of concern. And we're using the day hospital, we're using the clinic to say, okay, if we intervene proactively, we can keep you on a stable path, and we can hopefully prevent a year, 2 years down the line, a major fall and hip fracture, or prevent, you having a major issue with your diabetes or your heart failure and ending up, in an acute care center. So the purview, the passion, the drive, the motivation is looking at our population. How do we leverage all of these resources and leverage our expertise in collaboration to allow people to continue to age successfully in their chosen environment, which is usually at home, as long as that is possible. And
That's
that's
amazing. Dr.
yeah.
Dapperdine, that sounds exciting. Now, I think you mentioned, but we are working with St. Joe's Health Center. Is there any other hospitals that are interested?
Yes, sir. So we have, with the rapid rehab, we've also had discussions with the William Ulster Health Center, particularly Etobicoke General, who have expressed interest in also collaborating on the pathway. And we actually have a meeting with the Mackenzie Health Group on Thursday afternoon as well to discuss working or joining that partnership in addition. So, to me, it says that the conceptual framework is sound and something that our partners want. I've also had meetings with the Primary Care Network that works with the West Toronto, Ontario Health Team about how we can work with them with the day hospital. They've expressed interest in that as well. And we're really, again, looking at a frame of how do we work as a successful and supportive partner. But there's been a lot of interest, both specifically for the rapid rehab among those 3 hospitals, and more broadly with our geriatric services as well among the primary health providers in our region. And I think among patients as well, we're getting a lot of patients speaking to their families, speaking to their friends about what we do here. And I think that that's a trend that we can continue to see growth in as we move forward.
Sure. So I just want to circle back to the geriatric day program. Can you explain a little bit about how the new hospital building is going to enable the launch, and when is it launching?
Yeah, that's a fantastic question, Doug. So there are a few ways that the new hospital, 3 in particular, will support the geriatric day hospital, which I will say is, again, a program where people will come in, they'll be here about twice a week. We'll have a physiotherapist, occupational therapist, myself, social worker, and we'll really try to focus on physicality, medications, keeping people healthy. People are at home, keeping them healthy at home. So the new hospital in 3 ways. Number 1 is space. So we're going to have an expanded clinical environment in the new hospital, which will allow us to deliver programs to a broader population of patients. And that space, that physical capacity in and of itself is going to be wildly impactful as, again, we see that curve over the next decade to 2 decades with respect to the growth in the elder population in our communities. The second aspect of the hospital, the new build will facilitate the geriatric day hospital in particular, is going to be from the aspect of recruitment. We do know that bringing in people who are specialized, bringing in people who are passionate about care such as geriatrics, having a new facility, having new infrastructure, new IT, with new program building, we'll be able to bring in and attract talent, and I think retain talent. And that's what we're looking for, with the day hospital as well, physiotherapists, nurses, etc. So I think the build in itself is going to be an aspect of attracting and retaining talent. And the third facet in which the new build will be supportive of the geriatric day hospital is in the sense of the arena as well, in terms of delivering, additional, resources and supports in terms of what we have from an equipment perspective, what we have in terms of, as you mentioned, the therapeutic gardens, things of that nature. So it's really multifaceted, but we're very, very excited because transitioning into this 21st century build is going to allow us to deliver 21st and 22nd century care. And we do know that geriatric day hospitals have evidence for efficacy. So I'm excited about what we're doing, and I think that we are on the right path.
Well, that's just tremendous. It sounds like, first off, the right care at the right time in the right place. And of course, as you say, most people want to have that, be able to recover at home, but access those state-of-the-art treatments. And of course, it's very gratifying for our donors who are participating today, because it's through their support that we're going to be able to turn over on the day we take possession in July, just close to $25 million to support this new building, thanks to their support. So thank you, Dr. Dapperdine. I'm going to now just open up the floor for some questions. Of course, you can take or ask a question by clicking on the Q&A tab at the bottom of your screen. So I'll ask Anne-Marie and Shelley to join us back on screen with Dr. Dapperdine. And while we're doing that, I just wanted to do a couple of updates. Of course, this is our town hall meeting, and we have a couple of tremendous events coming up. On August 14th, we're at the Lambton Golf Course for a golf tournament. and the Guelph Classic to support these incredible new building that is going up just outside of my window here at the hospital. And then we're launching a new event on October 21st. It's called a Culinary Showdown, where we have quite a lineup of 5 celebrity chefs that you've seen on the Food Network or other Wall of Chefs. Of course, Lynn Crawford is well known to many of our donors, having been a part of Uncork virtually for a number of years, while she's coming to defend her title. And we encourage people to visit the culinaryshowdown.ca to sign up, start raising the money, because if you're the top 50 fundraisers, then you're going to be a part of that show, the showdown. You'll be, the 5 chefs will lead each of the teams to compete with a mystery box of ingredients. Thankfully, we're not going to be judges. We're not going to be tasting that food either. Only the judges that night will taste to award the trophy. But for everyone else, we can enjoy the show, be a part of the gala dinner, having a chef-inspired menu. The 5 chefs are going to contribute to the menu, and we'll be raising critical dollars to help us equip the hospital, as Dr. Dapperdine said. So just let me open up our questions here. I see 8, so we're going to be going there. So why don't we start? Anne-Marie, how can you get a referral to West Park?
Quite easily, actually, Doug. So referrals are made through your family practitioner. They will come into the appropriate clinic or through the admission department and then on for review. So it's a very direct path through your family physician.
Great.
Or primary care provider in the event that you don't have a family physician.
Mm-hmm. And another question is, how will West Park's Healthcare Centre, the new building, improve access to care in West End Toronto? Anne-Marie, do you want to start?
I'll start, and then perhaps Shelley might want to add. I think first and foremost, I'll build on Dr. Depperdine's comment around space. The fact that we're moving into a much larger facility is going to provide us with additional space to provide programs and services for the patients we serve. In particular, our outpatient space will be significantly expanded such that we'll be able to provide many more outpatient programs and hopefully achieve much higher outpatient volumes. Again, just looping back to Dr. Depperdine's comments, the idea of having a full continuum of care for patients who need to access our services is extremely important. And that full continuum of care must include outpatient, outreach, virtual, all sorts of different care that meet the needs of the patients and allow them to remain independent and in their communities for as long as possible. The other comment that I'd make, Doug, is we know that we have a little bit higher COPD rates in this particular area of Toronto. And as our guests may know, West Park has a number of respiratory services that focus specifically on COPD management, both on an inpatient basis and on an outpatient and outreach basis. So all of these things in combination will improve access to services for individuals who live locally, that is close to Toronto, but we will also continue our regional mandate and be able to provide these specialty services further afield into other regions of the province.
Shelley, did you want to add something?
Maybe just a little bit. Dr. Depperdine already touched on this, but in terms of recruitment, so we really do believe that this new facility will not only attract new individuals, but it'll also support our current staff, and that's really key. So in terms of the space that we've talked about, equipment, technology, just access throughout the building to various programs and services, that's going to be really key for us, because in the end, yes, it's about the building, but it's also about what we do within that building. And so we need to make sure that we retain our excellent staff and continue to recruit more as we grow through the programs and the facility itself.
Okay. So Dr. Dapperdine, you may want to unmute because there's a question here. This seniors rapid rehab program sounds like wonderful. like a wonderfully timely program for senior inpatient care. I'm curious if there's any discussions with other hospitals. The questioner mentioned Humber River Hospital.
Yeah, that's an excellent question. So as I alluded to, we have had a discussion with the Etobicoke General around the same, again, flagging people who are in the emergency department, and having an expedited, transfer to our rapid rehab for a 2 to 3 week stay. Mackenzie Health is pending. Humber River as a local hospital as well is on our radar. And we think, this is something that can be, as a model, because I did research this as a model, I think it's something that can be generalizable, for us, but also potentially looking at research and data. We can also look at this in terms of how this can be applicable to other similar institutions, whether that's in Ontario or further abroad. So definitely continuing to expand on the platform, and the way it's developed, it's something that really is, the colloquial term would be plug and play, but we've demonstrated that it works. We've had at least half a dozen patients so far. They've all successfully been able to get home. We've had patients where we've been able to review their medications, particularly things around falls. Managing pain has been big, and we've been able to do that with many of our patients as well. And we actually do follow up with them. So I see them in my clinic. So there's that piece of ongoing knowledge collection, but we have a lot of opportunity.
Great. One further question around what are some of the examples of the services West Park can offer to help seniors stay in their homes?
That's fantastic. So there are a couple. So I mentioned a little bit the seniors mental health group, but that's one of our adjacent programs in the ambulatory realm. So we have our clinic, we have our outpatient rehab, we have our seniors mental health, and they have an outreach group currently, and they're able to visit seniors who are living in their homes, and they primarily look at mood concerns, whether it's depression or anxiety or psychosis. But if there are other concerns that would benefit from a geriatrician view, they do often refer to the clinic. We work very closely with the seniors mental health group, and that aspect of outreach, I think, is very impactful. And as we move forward with our clinic, the building in an outreach component, seeing people in their homes, I think is something that, once we have the additional human resources, the people, and the structures, can really help to keep people aging well in their own homes. And as I have mentioned as well, the geriatric day hospital will be a key component, primarily because, again, it will be the anchor day hospital in this Northwest Toronto region. So if you're looking at drawing a circumference, whatever that circumference is, we are going to be it, and we're going to be that anchor. So we're looking at, really bringing people in who are experiencing some subtle changes, but we can, push up and keep them functioning well in their own communities. And that geriatric hospital is going to work very closely with my clinic. It's going to work very closely with seniors mental health. So our vision, my group, is that we have the geriatric services that are an integrated continuum. So as opposed to silos, the clinic, the mental health, the day hospital work together around the same goal, and the inpatient programs facilitating, people transitioning back home, and then their connection with, the clinic and the day hospital as well around the same goal. So really an integrated and collaborative continuum is what we have conceived as the future of what we're doing here. And I think that's the future of medicine in general. As I mentioned, no one can operate as an island. We do need to work as a cohesive unit, both within institutions and among institutions, as we are demonstrating here over the last few months.
Thank you, Dr. Daperdine. Now, Ian has a very practical question here for you. I'm sure this question comes up every day when you speak with families and individuals, but how do you persuade an elderly person to participate in exercise?
That is a fantastic question.
I said it was practical.
That is a fantastic question. That is a fantastic question, because it's very realistic. So a lot of the strategies, and I'll call them strategies, that I use particularly, and I work with Kimberly Day, who's our clinic manager, is amazing. Anna Carabao, our occupational therapist, and the inpatient team. So a lot of what we do, and I think what's critical, is looking at someone's individual goals, because I don't think you can have a block model time. I always do this every time. So the first question that I often ask is, what can I do to make your life better today? I leave it open. And then I start to ask about goals. What's your motivation? What's your goal? Some people say, well, my goal is I want to be able to walk 5 meters so I can go and pick up my mail and get back home. Some people say, well, I'm afraid of falls, so I want to do enough to reduce my risk of falls. Some people say, I just want to be able to ride a bike down the street again, or to be able to walk to my washroom without being exceptionally short of breath. So once we know, how can I make your life better? How can we make your life better? What are your goals? Then we start building in the, well, we have evidence that if we do exercise, and I often say we don't have to run a marathon, it can be 50 minutes of walking 2 or 3 times a week to start, and then we build up from there. If we do this and you are working with us and you continue with this program, we can help you meet your goals. It won't be today or tomorrow, but over time, you'll see that growth. And if you work with me, we can also continue to look at your other goals, what they may be. Some people say it's the medications, some people say it's being more social. So it's that give and take and understanding what someone's individual motivations are, what their psychosocial state is, and then integrating the evidence and the data. I can say 20% risk reduction if we have an occupational home assessment. If you do these strength and balancing exercises, we can reduce your risk by this proportion. So kind of working that in, but also following up. And I'm fortunate that the team I work with, the group is great about, intermittently following up with patients. How are you doing? What are your challenges and what can we do to keep you moving forward?
I just lost you at the tail end there, but Dr. Daperdine, hopefully we'll get your sound back. Shelley, how will West Park staff be ready for the new hospital and all this state-of-the-art technology?
So there's a very extensive training and orientation program that is currently being planned. So again, we know that not only is the space new, but the geography, how one gets from point A to point B, the technology, the equipment, a lot of it is very new. So we are right now planning for the number of hours and days that it will take to train our staff. And so they'll be involved in that. We'll have trainers come in, we'll have vendors come in to actually, help everyone understand how some of these pieces come together, so that they actually feel comfortable in terms of, functioning within the space, again, caring for the patients, and really just understanding how they get around the building as well. It's all very key part of it. So that will likely happen towards probably more October, November. So just before the move, because it's really important that it's very fresh in everyone's mind in terms of how to actually operate within the building. And certainly we want to give staff some tours. Again, they need to be comfortable with the space and all the various components that they're going to work within.
Mm-hmm. And how are we implementing family zones in each of the patient rooms?
Yeah, so the family zones, the way we've created or designed the patient rooms, we have, I'm going to say the staff zone, the patient zone, and the family zone. And we really wanted to integrate and bring this all together. So typically we'll have the staff zone, we'll have, a lot of the equipment, how the staff will approach the patients who are, generally in the bed or in the center of the room. And then there'll be the family zone. So we know it's really important for families to be a part of that circle of care. So there's a seating area there. They'll be able to, converse with the patient or their family member. I think that's a really important component of it. So we've created those spaces or those zones within each patient room.
So, Dr. Daperdine, do we have you back? I see you're on mute. So let's.
I think you can hear me now.
Yep. No, great, good.
Okay.
Because Esther's asking a question about the term that you use, biopsychosocial. What about spiritual part of their lives? And how do we plan to meet this need, all those aspects to make a whole patient?
Yeah, that is beautiful. Thank you, Esther. That is beautiful. So, speaking of the biopsychosocial model, like very, very shortly, it was one of the key components when I was in medical school. And one of the things that my biggest mentor in geriatric medicine, Frank Molnar, had said is really key as well. So it's looking at obviously the biological frame, your medical issues, the psychological frame, whether it's the memory, the mood, etc., and the social frame, like where are you in your community, with your family, with your friends. But I definitely agree the spiritual aspect, whatever spirituality means, whether that is a connection with some type of deity, whether that's just an internal sense of spirituality, whether that's religiosity, is integral. And that's actually one of the main questions that I ask almost all my patients. I had a patient actually yesterday, and we were discussing Baruch Spinoza. I studied philosophy in undergrad, and
she's clear, Dr. Trammell.
Yes.
We hear your philosophy coming through.
So and answering the questions, very, very direct. So we're speaking about that. So, we do have spiritual care, here at West Park, and I do have a lot of patients who have appreciated that, talking to spiritual care providers. And I think that what Esther is asking is really how do we focus on the key elements of someone's existence and ensure that that's integrated to care? So that's asking the question again, what is important to you? Who is important to you? How are they important to you? And how do we integrate them into your management? And that includes spirituality, that includes family, that includes friends. A lot of my patients, unfortunately, they have family members who have passed away, but they have good friends who are close to them as well. What about your community is important? So asking the questions, but also having the experts there as resources. So social work. One of the things that is important to me is expanding our social work capacity as we move into the new facility. Spiritual care, ensuring that's stable. Our psychologist has been very, very critical as well for many of our patients. And we bring all those people to the table when we have our rounds. I had our team rounds earlier today, and we have all our members at the table. So having the people at the table and asking the question and honestly listening to the answer, I think is the start. Ask,
Now,
listen,
Shelley,
and
we've designed the building to accommodate spirituality as well. How can we not?
Absolutely. So we have a spiritual care area, if you like, and I think it's what Dr. Depperdine's saying is asking what is important to these individuals and where do they want to be? Where do they want to contemplate? Where do they want to have these discussions? So we've created, a beautiful space for that purpose, and or anywhere else an individual feels comfortable. So it's multi-denominational. Again, it's just that space for reflection. We've also created a spiritual care garden, which is just adjacent to this area on the level 1. So again, it's about nature and how is nature important to that individual from a spiritual perspective, from a therapeutic perspective. Really very key, I think, in terms of our design intent. So we've purposely created this space in this area for exactly how Dr. Depperdine's, I think, explained it very, very well.
Anne-Marie, the next question from Fredella is with you. You've talked an awful lot about an integrated campus of care. And so the question around, will there be family medical services for elderly community adjacent to West Park?
Mm-hmm. That's a great question, and Fredella has a great memory on this issue. The vision for the campus of care has always included bringing primary care services to the campus. And so we are in active discussions about a few options that we can explore to ensure that that's the case. I might add that bringing primary care services back to the campus in the form of a family health team or some type of family practice type of facility would be part and parcel of what we fondly refer to as our non-hospital development. So not necessarily part of the hospital proper, but of the development of the non-hospital lands.
And then one question, Shelley, is the new hospital building going to offer exercise programs for in hydrotherapy?
Yes, we actually have a pool that we have built. For those of you who are aware of the pool at West Park today, it's relatively small in comparison to what we have created. So absolutely, we'll have a pool. It's totally accessible, which again is very key for our patient population. So there's an overhead lift, there's a lift on the side of the pool, and the way we've designed the pool, it has different levels, if you like. So again, depending on the comfort level of the patient and the therapist and how much work they want to do within the pool, that will be available to them. We've also created, it's commonly known as Snoozland, but a multi-sensory pool. So that would incorporate music and lighting and bubbles, again, just to try, to make the experience as positive as possible. Somebody asked earlier about exercise. That's an important component of the therapy, and I think what we've done or tried to create a space within that pool that will actually encourage that. Although it might be challenging for some, but certainly we're going to try and make it as accessible and as possible as we can for our patients.
Thank you, Shelley. There was one question I skipped over, and I'm going to start with Anne-Marie, and then I'll chip in as well. But just wondering, how does the foundation support West Park Healthcare Center?
Oh, that's a question to me, Doug?
Yeah.
Okay, what a great question. I love that question. The foundation has been doing an amazing job, and particularly under Doug's leadership recently, in engaging with friends and donors to the center. And that is critically important because, as we have mentioned in previous communications to our friends and donors, the Ministry of Health does not completely fund the cost of a new hospital. And so we are required to make a contribution to the cost of building this amazing new facility that is going to be a tremendous asset, not only for this community, but for all of the populations that we serve here through our many, many programs and services. So that we rely on the foundation to fund equipment, to fund the construction, to fund research, and to fund patient care programs. And we are very, very grateful for the tremendous work that they do and the leadership that is provided both through the foundation board and through Doug and his staff.
So thank you, Anne-Marie. Yes, so I will just remind about our upcoming special events. The August 14th Golf Classic at Lambton. It's only, I think they do 3 events a year, so it's a very exclusive access that they've allowed West Park to have to raise some funds and enjoy some good exercise and maybe some frustration around a golf. But also our culinary challenge on October 21st. And of course, we've recently, we had one of our supporters match donations up until the end of May, and I'm very pleased to say that we have raised more money so far in equipping the hospital than we did last year in this mailing for the whole year. So we did that in a 4-week period. So of course, happy if you would like to just reach out to the foundation at westpark.org in order to raise your hand, and we'll be very happy to talk about ways that you could support the hospital in this new building. And then of course, after the new building opens, finishing the outdoor therapy spaces by 2025. So I see one more question, and Anne-Marie, it's about the non-hospital development. So just maybe explaining a little bit about that. Of course, one of the big decisions we made was having underground parking, 3 floors no less, which has created an opportunity on our campus that I'll let Anne-Marie explain a bit more.
Yes, so in addition to the hospital proper, we have about a 4.7 acre parcel of land that is at the east side of the property. And it is our intent to expand out the continuum of care that is provided on the campus. So that's part of the vision for the campus of care. And we intend to develop these lands in a number of ways, but with a focus on seniors and individuals living with disabilities. Last year, we were successful in our application to government and were awarded a new additional 256-bed long-term care home. In addition to that, we hope to bring, as I mentioned, primary care services, in other words, a family practice type of operation to the non-hospital lands, along with other types of assisted living and supportive housing, perhaps some hospice and community-based services. These are all options that are currently under consideration, and they will help us to build out a continuum of post-acute services here on the campus that will respond, again, to the needs of the populations we serve, and in particular, in many respects, to our local community.
Thank you, Anne-Marie. So I'm afraid that's all the time we have to answer questions. And so I'd just like to take a moment and ask each of our panelists to say a few words in conclusion. Dr. Dapperdine, would you like to start with some parting thoughts?
Yeah, definitely. So, I mean, first of all, thank you for inviting myself to represent the geriatric team here at this event. I think that it was very much appreciated. And I'll say in short that at West Park, we are at a critical juncture. We are on the precipice of a new beginning and a lot of amazing opportunities. And I think that if we go into this with a spirit of compassion, a spirit of sincerity, a spirit of collaboration, a spirit of solidarity, that we can leave a truly lasting impact moving forward over decades for the people who really need it the most in our community. And from my perspective, as someone who has come into the West Park family, I think that the future belongs to us. If we do this well, we can really transform and be a beacon, not only here, but a beacon throughout the country in terms of great community-based geriatric care. So I'm excited and I'm happy to continue to work with everyone for, the future.
Great. Well, Dr. Dapperdine, I think you've conveyed to our donors the passion that you bring. And of course, it's one of the most critical learnings from COVID is that we have to do a better job providing care to our seniors. And it's just a privilege to have you here at West Park and leading the charge to deliver and take full advantage of our new building. So Anne-Marie.
Well, Doug, now that you've mentioned COVID, I'll jump in and say we've spent the last 3 years at West Park and as a society trying to run and hide from contagions. And this last hour has demonstrated to me that there are some things that are contagious that are really positive. And in particular, I'm referring to Dr. Dapperdine's passion, commitment, and enthusiasm. We're very, very lucky to have him on staff at West Park and leading the geriatric services. I hope all of our friends and donors here with us this afternoon can see that we've got an awful lot of exciting work underway, and it is all leading to improved access and improved care for our patients, which is why we're here, and it is all about what we're doing. So we're very much looking forward to the opening of the new hospital. And of course, the transformative changes that will be brought to the campus. And I want to thank each and every one of our guests today for all of the support they provide in the many ways that they provide it. We couldn't do what we're doing without you.
Thank you, Anne-Marie. Shelley?
I don't know how I top both of those, but I'd say it's always exciting to be able to talk about the new hospital. It's almost here. You see that rendering behind Anne-Marie. It's real. It's not a rendering anymore. It's real. We're there. We're going to be moving into a spectacular building. We've talked a lot about seniors in our population. That the design of that building was about being senior friendly, true accessibility. It's about thinking to the future, whether it's physical, if it's emotional, social. We've really, really tried to work on the design to make sure that it is truly accessible for all our patient populations now and in the future.
Great. Thank you, Shelley, and thank you, each of you, for participating in our panel today. As you can tell, we sparked a lot of questions and dialogue, which is fantastic. And I just wanted to part a few thoughts to our donors present and the donors that will watch this after we put up the recording, that this has all been made possible because of your generosity. We're so excited to be able to invite you on campus in 2025 and show off everything that you've helped make possible. So thank you. Now, I'm going to transition to introduce Janet Griffin, our vice chair of our foundation board of directors, one of these amazing volunteers that make all the difference for us, to say a few closing remarks. Janet?
Thank you, Doug. And thank you, Dr. Depperdine, for that very informative and heartfelt presentation. Your enthusiasm for your work shows through. On behalf of the foundation directors, I want to say thank you to all of you for joining us today and for your continued commitment to West Park. We couldn't have gotten to the point of opening a new hospital without the support of our community. And we are deeply grateful for your help in getting us to this point. But even as we celebrate the wonderful milestones to come this year, we know there's still much more work to do. Our beautiful building is just the first phase in our redevelopment, the platform, so to speak. We will still need to put the park back into West Park. We'll begin this next phase early next year. In place of the current hospital and the Ruddy buildings, we will create walking paths for exercise and relaxation, community gathering spaces, quiet gardens, and outdoor therapy spaces that will better support patients in their recovery journey. So thank you again for joining us today, and enjoy the rest of your day.